Yeah, I just changed my hat because I retired from the IMSS.
Oh, okay.
I should retire from everything. Anyway, I appreciate your invitation. So thank you very much. And it's going to be very brief. And what I'm going to share with you is that in Mexico we have a sugar problem, as you may know, everyone. We have the strongest epidemic in diabetes and obesity and metabolic disorders. And well, we cannot blame only sugar intake, but maybe one of the pieces of this problem. And then one of the data that we can share now, and this is something related with the previous presentation, that is, we are having a lot of sugar intake, and this is far from the levels permitted, and this is more than double, and in some age groups, it's something like in adolescents, it's going up as 25% of sugar intake. This is from calories, and this is a lot, and this is something that we have to take into account for all these problems. I think yes, but this is not the only thing that we should take into account. We are reducing some of the. We are changing some of the lifestyle factors that we should take into account. But then, anyway, if we see where is this sugar coming from, this is mainly coming from sweetened beverages. And this is something that is really making a big problem. And maybe it's going to be a very easy solution if we can change the policy of adding sugar to these beverages, or just putting taxes or simple procedures. Well, maybe not. But we have to make the effort of doing this and to evaluate what is the impact of having so much sugar in our diet. And we have been doing several analyses on what is the impact of adding sugar to our diets. And this is, no matter what you have as an endpoint, no matter, sugar is related. And it's with an adverse association. That's a terrible thing. And no matter what you do, you analyze, this is coming like a terrible result. Doubling the risk, or even more than that. Just because you have people in Mexico that you can have a quintile of the population that is having more than 3 beverages a day. 3 sugar beverages. And this is a lot. And then you have 20% of the population in a very, very high risk, double or tripling the risk for almost every single metabolic disorder. And then this is what we should see as the real problem. But what if you move just a little bit from added sugars? If you go to dietary patterns with a high content of sugar, added sugar beverages, and then you see exactly the same picture. And this is something that we have to take into account, because this is not only sugar. This is a pattern of eating that has been changing in the last few years. In fact, we can see a reduction in beverages, reduction in the 5 or 7 years back, but not so fast. That's why we have to make an effort to make it faster, and as well as to make it as a combination with dietary patterns and some other lifestyles. This is it. I think that I'm done in the time.
Right.
Thank you.
Thank you, Jorge. We have 3 minutes for questions. Jorge, stay there.
Yeah.
Are you starting to see any change in the public perception of sugars? And so what would be the common thought about having 3 sugar drinks a day? Is that acceptable, not acceptable to the average person in Mexico?
This is something that we are evaluating right now, but it seems that not coming from our studies, but coming from some other studies in Mexico, that is, the people is worried about this, and they will prefer to have less sugar in almost everything.
Just this week, when I made a presentation, the department head said to me, well, the new data out of Mexico shows clearly the tax is simply regressive because the sugar-sweetened beverage went up after that initial decrease. It is now going back up, and therefore the only effect of this tax is that poor people are being unfairly taxed compared to rich people, and nobody has changed their consumption. Is that true? I haven't been I saw the first year results and applauded. What's going on? Has it really gone back up?
No, I will say that making an analysis after 1 year or even 2 years of whatever you do is unfair.
Okay.
And because this is a change of maybe 25, 30 years effect on changing patterns, and just because of a very light increase in taxes, it's going to, we have to explain everything with that. Well, that's almost impossible and will be totally unfair just to make a judgment for that. But I will say that there is a big interest in the government just to see if there is any possibility of doing something with the taxes. It's not only Mexico that is trying to do that. It's all over the world. And it's not only for sugar added to beverages, but for all sugar intake. And this is something that we have to pay attention to, what is going on with that, and if this is going to be the solution for obesity epidemics all over the world.